What happens if you don't take injections for macular degeneration? This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. Definitely, there are patients who come and say, if we don't take the treatment for macular degeneration, is that still okay? How blind will I become? Will I lose my vision completely? Uh, you must understand macular degeneration affects only the macula. The macula is the central portion of the retina. So if some problem happens to the macula, as in macular degeneration, only central vision gets affected. Now, in the early stages of a wet macular degeneration, it is possible that you still have good vision in that eye. And all that really happens is probably you see a black patch in your vision, or probably you see some amount of distortion in your vision. The letters look a little smaller or sometimes a little wider. These are small changes, but you still have good vision in that eye. Now, if you don't treat it, what happens is a big scar forms in the center of the retina. And please understand, a scar is something permanent. We cannot remove the scar and replace it with healthy retinal tissue. So, if you are going to have a big scar in the macula, your central vision is going to be permanently affected. So, which means you won't be able to read those fine things coming on your television. You won't be able to even read properly with that eye, because central vision is extremely important for these kind of activities. However, this is not a completely blinding condition. You will be able to do your daily chores, especially because your peripheral retina is functioning. Now, there are patients who have associated glaucoma with macular degeneration. These patients suffer the most because peripheral vision is gone due to the glaucoma, and central vision is affected because of the macular degeneration. Whatever it is, there is a stage when macular degeneration can be treated with injections. If you go past that stage, you cannot be treated no matter where you go. So I would recommend, if you have a problem with the macula, if you have active macular degeneration, please take treatment, take injections for your problem. The injections rarely cause any side effects. And the reason why I'm saying that is, as long as you're taking injections from a good company, they normally don't have any problems. It is possible that some drugs are contaminated and things like that. That does not happen for the branded drugs. So we recommend, since you are giving an injection inside the eye, always take something which is highly recommended and a good brand. Now, if you do take treatment for macular degeneration, it is still possible that you lose some amount of central vision. Now, the aim of treatment is to reduce your scar to the smallest possible size for your retina. So eventually this does scar, and the aim is to make it a very small scar. So you cannot compare this eye with the eye which is not affected. So your vision can never become absolutely 100% normal. There will be some change in your vision because your macula is already affected. If you have had macular degeneration, you feel the injections have worked well for you and now you're fine, it is still possible that in future, many years later, you may develop a recurrence. And if that happens again, you need to treat that active macular degeneration. Earlier, injections were not available. There only used to be some laser treatment and something called PDT, and visual acuity would actually come down dramatically in spite of treatment. So now we have excellent injections which actually help improve your vision to a great extent. So do not hesitate from taking injections for this purpose, because this is the only way we can save vision. And the important thing is to do it on time. If you delay it, you think, I will come back later and I will take treatment if my vision goes down even further, then you're not doing the right thing. What you need to do is take treatment when there is a problem. Do not wait.